as soon as you go down that path of you're born in the wrong body, we're going to change your identity, we're going to do all this, alter your body, you stop looking at the root cause of this. And we know from studies that most of these children have underlying mental health problems like depression, anxiety. Many of them have had traumas, whether it's abuse, sexual abuse, or just difficult life events that have, like I talked about earlier in this segment, that have harmed them. Or a lot of these kids also have neurodevelopmental delays, things like autism. And that's important to know because those children think very concretely. And so if you tell them the reason you're not getting along socially is because you're born in the wrong body, they believe that wholeheartedly. They jump right in 2 feet and they believe that they can change. They don't understand the nuances that are involved. So my biggest concern with once you start treating children with gender dysphoria or discomfort in their sex, that pathway, you ignore all the other problems that the child may be having. So I wanted to put emphasis on that because that's really where the solution lies, in addressing that. But then if you look at what this pathway does, once you start so-called affirming a child or telling them that they are the opposite sex and then that they can believe the opposite sex, you put them on this conveyor belt or a train that is really difficult to get off. So it starts right there. It seems harmless, letting them dress in clothes, more appropriate for the opposite sex, or, choosing a different name. But it really sets them up on this conveyor belt and it's very hard to get off. So that is dangerous to even start. And then puberty blockers are touted as you just pause puberty, give a child to think. They're totally reversible. And that is completely a lie. Dr. Cass explained this very well in her review, that puberty is a time where children who have this gender dysphoria, most of them will outgrow it if they're allowed and supported through natural puberty. The hormones are needed to bathe the brain during this process and develop their thoughts. And all of us experience discomfort during puberty. And so to work through that, and that is necessary for a child's growth, those hormones, and it actually helps them be comfortable when they get on the other side of puberty. So when you stop that, you take away one of the best treatments we have for this. And, why would you intervene with anything in medicine that has, a rate of anywhere from 80% to high 90s of naturally going away on its own? So we shouldn't intervene. But so those puberty blockers, pause puberty. We know that puberty is also necessary for a lot of important brain development, IQ, intelligence, all of that. We know so little even about what all those hormones do during development. So if you were to restart it, you can't catch up. You can't make up for what that child has lost. And then you now have a child who is out of sync with all of their peers in development. And so that's the dangers of puberty blockers. And then if you keep a child on puberty blockers and then you pause them at an early stage of puberty before they've had time for any of their sexual organs to develop, egg, sperm, all that, and then you put them on opposite sex hormones, this will sterilize a child because they will never fully develop those gametes, the sperm and egg that are necessary for reproduction. So they'll never have children of their own. So that right there is a big consequence of these treatments. And then these opposite sex hormones are delivered in really high quantities, and they are not intended to be in the body at those high levels. And the child would need to stay on those for the rest of their life. So you've medicalized a person for life. Their body will never take over production of those hormones on their own. So you've medicalized them. And then if you say, well, if you're still not happy, let's do surgeries. Well, then you're talking about changing, removing, altering completely healthy body parts. And that is just not something we do in medicine. We would not do that for any other thing. And so, you obviously you can sterilize, but these children who have had these procedures done, they leave big scars, lots of consequences, damaging to their body, a lifetime of pain and medicalization.